Hey there, Justin Jacobs with Health Plan Markets, and I have some pretty big news on the Medicare front for the health insurance industry. So, for the very first time ever, those folks that have end stage renal disease, ESRD, or stage 4 kidney failure will now, for the first time ever, be allowed to join Medicare Advantage plans. Now, this is a game changer for a lot of folks because when I was out there helping people, there were a few people that I just had to turn away because Medicare Advantage did not accept them into that program at that time. So, for this open enrollment, which is 2020, for enrollment season 2021, starting October 15th and through December 7th, those folks that are interested in enrolling into a Medicare Advantage plan will be able to do so during that time and be effective for January 1st effective. Now, why is this so important for folks? Well, a lot of these people are still on original Medicare, which means that there's still some gaps in there. There's the 20%, there's deductibles, and then a lot of them don't even have prescription drug coverage, which then exacerbates the situation, making it very, very difficult to pay those bills, especially if you're going for dialysis service, which is necessary. And a lot of these folks are going 3 times a week. So you times that by 20%, and it can be financially devastating. Having a Medicare Advantage plan, some of these plans will help with those dialysis costs, which is a great thing. And also, they're able to get additional benefits that they weren't eligible for before Medicare Advantage was allowing them into the program. Now, there are going to be quite a few options out there available. Remember, you have Medicare Advantage plans, HMOs, PPOs, special needs products like those that have both Medicare and Medicaid, dual eligibles, or those folks that have maybe a chronic condition like diabetes or heart failure in addition to their kidney failure, then they would be eligible for those chronic condition plans or CSNP plans. But it's just important to make sure that you're reviewing the coverage and they're getting the proper plan that fits their needs. Now, in some areas, specifically in New York, there are specific Medicare Advantage plans that have already been created for folks that have ESRD. So they can go out and enroll in one of these products starting in January. So some of them are already out there as special needs plans, but everyone else on a core plan will now be able to join on January 1st. Now, going out there and marketing to these folks, I would say dialysis centers, obviously you can leave flyers and your information there, and then as well as nephrologists or your kidney doctors. Those are other places that you can let people know that you as an agent that offer Medicare Advantage plans, you can go out there and let them know that you're out to help folks. Those are the two places in my mind that come up as far as places where these folks are always going. Now, who's right for a Medicare Advantage plan? Now, that's the tough part. But I will say that it breaks down to two things. The first thing is compliance, and the second thing is what the person's needs are. So the first thing is compliance. If the person is not taking their medication and maybe not going to dialysis on a regular basis, maybe not seeing their doctors and goes to the hospital quite often, then a Medicare Advantage plan may not be a good fit, especially an HMO plan would probably not be a good fit. A PPO might be good for that person because they still have the flexibility and they could still go out there and do their thing, but an HMO probably won't be a good fit for that person. Probably better leaving them where they're at. Now, a person that is compliant, someone that goes to dialysis on a regular basis, follows the instructions and goes to the doctor, takes their medication, and does their best not to go to the hospital, that's a compliant patient. And that person might be a really good fit for Medicare Advantage plans, especially in HMO. So although there is costly dialysis service and other expensive services in the healthcare for these folks, Medicare Advantage is not out of the question. And one of the reasons why they're now allowing folks that have Medicare Advantage that have ESRD is because financially it's okay. The government is saying that this will work. So don't be shy to offer those products out there. Just make sure you do your due diligence and ensure that the person is on the right plan for the right reason. Now, if you're out there and you have questions about end-stage renal disease or kidney failure and how it relates to Medicare, you can give us a call. We're available Monday through Friday, 9 to 6. Give us a call at 844-696-3975, or you can go out and visit us at askhpm.com. The links are below, and for other updates, especially about Medicare and end-stage renal disease, you can click the subscribe button on our YouTube channel, and we will keep you up to date when these things come out. So really appreciate you taking time to watch this video. Hope you have a great one.